Good afternoon, everyone. It's great to be with you again for another episode of Conversations from Stritch. Dr. Christopher Sint and I are here in studio this afternoon, and I am really glad to be back. Last week I had to miss, and I was sorry for that, but it's wonderful to be back. I did want to just open up with a few things. We were really glad to have family weekend virtually this past weekend, so grateful to all the families who participated in that. The scavenger hunt and the bingo that Dr. Sint helped to run, all great events, and we're sorry we couldn't have you on campus, but it's great to get people together. Another thing that happened in the last week since we've been together is that on Monday, U.S. News & World Report released their rankings. And again, Lewis was in the top 25. It's a great ranking for us to be in the top 25 in the region, alongside some really excellent universities. And we're proud of that, and especially proud of being ranked 18th in social mobility. Social mobility is a way that they rank schools based on Pell-eligible students and the likelihood across the country for them to graduate in 4 years, and then the likelihood of other universities to actually get those students who come out of challenged economic circumstances to get to graduation. And Lewis is one of the top universities in the Midwest to be able to help students along that path when they're facing additional challenges based on economic circumstances. So we're very proud of that. It fits with our mission. It's something that we normally are included in that group, but moved up a little this year, and very proud of that. The last thing I just want to mention to everybody that's here is that in the coming month or two, we are going to have a number of virtual visit days. So for students, parents who are watching this, employees, to know that if you have a niece or a nephew or a cousin who might be interested in some of the programs that Lewis has to offer, we certainly would love to have them join us for one of our visit days. There'll be more visit days that'll be smaller, probably smaller attendance in number, and a little bit more focused in terms of our message as we move through the year, because we won't be able to have what can normally be 700 or 800 people in the field house. So we're going to be doing those in an online format, but just invite you to pass that along to friends and family who might be interested in joining us and learning a little bit more about Lewis. Today on the program, we're going to talk a little bit more about our responses to COVID-19. We feel good about kind of where we stand right now, third week of the semester, but we still have a lot of really important work to do to both keep the community informed about what it is that we're doing relative to COVID-19 and quarantining and contact tracing. And so with that, I'd like to turn it over to Dr. Sint, who will introduce our guest and talk a little bit about a few other things going on campus, but then getting into how we're addressing COVID on campus.
Yes, hello everyone, great to be with you. I do have a few announcements I'd like to make that are somewhat eclectic before introducing our guest, Dr. Nancy Ryland. First of all, I want to say one thing about Family Day. Listening to you reminded me that it was, this whole experience has been full of learning, and I think that day is a good example of that. We came out of that day, there's so many great activities in addition to the ones that Dr. Livingston mentioned. There was a great improv hour, there was meditation, there was a cooking, a recipe contest, and a lot of the faculty and staff who led those activities came out of it thinking, oh, we can just do this, we can continue to do this all year. So I would expect another Family Day probably at some point in the year, but also individual hours of things that are reaching out to students and family where some of these activities can be continued, because it was great. And I think we also know that having an entire virtual day is a little more taxing than an entire day in person for people's attention and so on. So we will continue to do that in a kind of new way, and we may even have learned from this and continue to do it in years to come because it reaches out to people in a different way. Next, unrelated comment is that we had a question through the ask@louis.edu about parking fees. And so if you would like to make a request or to apply for a refund for parking fees this semester, please contact the police department and they will direct you to the form that needs to be filled out in order to make that request. The next thing I want to talk about is we had a really successful student flu shot administration on Tuesday of this week, where 270 of our students received flu shots. And if students are out there watching and would like another opportunity to get a free flu shot on campus, we're going to do it again in a similar format on October 2nd. So please be on the lookout in social media and in my emails and so on for ways to sign up for the flu shot. And this week we also had walk-ups, which I'm sure we'll be able to have as well on October 2nd. Next, I want to say that we have, if you haven't noticed and been on campus, it's been lovely weather. It's fall or the end of summer. It's great to be outside. We have set up several outside Wi-Fi access points for places on campus, and a lot more chairs and seats across campus. And I think we've talked before about how we have classrooms on campus, outdoor classrooms that our professors are making use of. But this is more for students who want to sit down and access a class or just work with Wi-Fi. So those areas are expanded to include the parking lot L, and that Wi-Fi access includes the patio in front of the Brother Paul French Learning Resources Center. I just walked by there today. It really has some great chairs out there and so on. So that has Wi-Fi access. Lot W, which is the lot below the baseball field, the Brendan baseball field, and then the outdoor patios at the Brother James Gaffney Center and the courtyard of the flight deck. All of those outside areas have Wi-Fi access for sitting outside and working. And then the final thing I want to just say is really a repetition, but and we're just going to keep saying it. We really need everyone. If you haven't downloaded the Lewis U app and started doing the daily health screenings for residential students or the health screenings for employees and students who are coming onto campus to attend class or to work, please do that now. It's essential for filling out the symptom screening. It's essential for reporting. It's our preferred way of reporting positive COVID-19 tests. It's how you reserve indoor study space, and it's also our best way of communicating other things. Like there's a great tile on there now about the difference between quarantine and isolation and so on. And so as we announce new things, it's often, we do it in social media, we do it in email, but we think the app is a really great thing for our students and employees to have in order to get updates and so on. So please download that if you haven't, and I know almost everyone watching this has done it already, and thank you for doing that.
So, Chris, could we I know you're going to introduce Nancy, Dr. Ryland in a second here, but just on that front, and maybe we'll talk about this specifically with Nancy, but we think there's many reasons why our numbers are in good shape relative to some other universities that might be out there. I've heard people have come up to me and said now they're able to see these numbers in all sorts of different areas. Certain newspapers are publishing them on a daily basis. It feels like the app is one of those things, many things that we're going to talk about today, but one of those things that is helping us to maintain a level that feels good. And I know last Friday we reported a new set of numbers on those cases. Maybe just because not everybody looks at the website, maybe you could just give a sense of kind of how that is moving or progressing as a community, what we're seeing week to week.
Yeah, I'll make a very general comment about this, and when we get Nancy on, she might have an update for me. I think this week's numbers of positive COVID-19 cases is up to 3 as of today. And again, we will report it tomorrow afternoon, so there's a day between now and then, but that's the, I think, the facts of the reporting.
But last week was 12, is that correct?
Correct.
Yeah,
Yes.
so I just think, this general sense of those people that watch this but don't click on the, because I think we had, in that 1, 2, 3 a week throughout August, and then we had a increase to 13, and then 12, and then this week is a little lower. We'll see what the final number is tomorrow. But just that sense for the community that when people are seeing 500 cases or 750 cases at other universities, we don't want anybody to get sick on campus, but our numbers have been moderate, I guess is what I would say.
Yes. So let's continue to talk about this with Nancy
great.
involved, because she's definitely got opinions about these things and expertise. So I'm really excited to introduce Dr. Nancy Ryland, who is an associate professor of nursing. I'm going to give her a little bit longer bio introduction. I did this last week as well with our faculty guests, and it's again not only an update on how we're approaching these issues especially around contact tracing and testing, but also an introduction to one of our great faculty members. And so I want people to know a little bit more about her. Her research includes infectious disease and HIV infection and testing, and her clinical interests include geriatrics and long-term care, family practice, and subacute rehabilitation. And she teaches in our nursing department epidemiology, biostatistics, and nursing research and scholarly inquiry. She's been a tremendous help in both educating our community and in working alongside our healthcare professionals on campus and our COVID-19 hotline team. So I'm really happy she's accepted our offer to serve as our coordinator of contact tracing during her sabbatical year, which we want to ask her about. And in this capacity, she's managing our COVID-19 case contact and investigation services, and managing our testing as well, and as well as serving on our COVID-19 hotline team. So I'm very happy to welcome you, Nancy. Hello, I see you.
Hi.
And it's great to be with you. So
Thank you for having me back.
I'm just going to ask the first question as a kind of big general question. Could you just tell us a little bit about what contact tracing is and how it works in this context, or how it works at Lewis and with COVID-19?
Sure. Just globally, contact tracing is a very important public health effort, and it is the epidemiological process of identifying a case and then finding out who that case may have spread that infection to. And then finding and identifying and contacting those people so that they can take appropriate measures to protect others so that they don't continue to spread. And so here at Lewis, we're partnering with our local health department, Will County Health Department, and along with the guidance from the CDC, the Illinois Department of Public Health, we're partnering so that we can make those quicker contacts with people on our campus that may need to isolate if they're a case and quarantine if they're a close contact.
Great. So, and that's a reminder, and
Go ahead. That's the question I was going to ask.
Do you know what I'm going to say?
You go ahead.
Okay, so John, we've talked about the website that has the numbers on it. I forget what we call it.
Dashboard.
The dashboard. Yeah, and it also includes like kind of a flow chart with a differentiation between what isolation and quarantine is. So some people in the audience might be tired of us talking about that, but I think some people are still really learning, and I know especially when I'm watching the news or listening to the news outside of Lewis, those terms are confusing and used differently. So could you help us, remind us what the difference is between isolation and quarantine? And I believe, John, if I remember right, it's right below what you're showing is that that flow chart.
Yeah, and it's no wonder there's confusion because they are often interchanged or used inappropriately. And there isn't a huge difference. The main is that a case, so somebody that is presumed to have COVID or had a test and was positive, they're asked to isolate, which is a stricter quarantine. It's taking yourself away from anybody else so that you don't spread that infection. So it would be being in your own bedroom, ideally having your own bathroom, having someone deliver your meals, and hopefully maybe have disposable paper products so that they don't have to do those dishes. So it's enhanced protection. In quarantine, it's staying away from others that you might infect. You could be in the same household with others, but you want to really watch that social distancing, wear your masks if you can, be particular about hygiene, washing hands. But it's not that you have to really totally separate yourself.
Great, thank
So
you.
it would be, not going out, not going to the store. It's limiting any interaction with others.
Okay, so let's just say we have a positive COVID-19 case on, with one of our students or one of our faculty members or staff. And could you just describe a little bit, what are the questions, they're contacted by one of the people doing contact tracing, and what are some of the questions that we ask and need to know from them in order to make sure that the people they've been in contact with are safe, or that we know everything we want to know or need to know about who they've been around?
Sure. So let's say a student reported to the hotline that they had a positive test, or they had symptoms and then became a positive test. We would first contact them to talk about isolation, find out about their housing situation. If they're on campus, do they need to move to a single room? What kind of support services that they need? And then also to talk about the timing of their isolation. And generally that is 10 days from either a positive test or the start of their symptoms, whichever came first. At the tail end, before they can be released from isolation, we have to make sure that their symptoms are resolving and they haven't had a temperature for 24 hours. They would also need a physician's note saying that they're cleared to come back to class or to work if they were employed. From that, during that conversation, we'd also find out the people that they've been in relatively close contact with for the 48 hours before they either tested positive or had symptoms. So that's the tricky part, because the CDC definition of close contact is within 6 feet of each other, even if you have masks on, for 15 minutes. But that could be cumulative over those 48 hours. So if you were in several classes with somebody and you stopped and you talked with them for 5 minutes over, 3 or 4 times, that might be considered a close contact. We also get guidance from the health department as to if somebody's sitting in a class who might be at increased risk, and which is why seating charts are very important, and scanning in with the QR codes so that we can help identify and contact those individuals. And they would then be called and told that they've been identified as a close contact and given information about quarantining, what that looks like in their situation for 2 weeks.
Thank you. So just to follow up, because this is kind of what you were asking me before we asked Nancy on, if there is a lot of knowledge about, for example, the seating chart of a class. The QR codes were used 100% in that class. We know when everyone came in and who was there and where they were sitting. There are fewer, we have more accurate information about how those close contacts are interpreted. If we don't have that information, we have to assume that there was close contact when we don't have proof that there wasn't, or so on. And I guess that's it's a real question, but it's sort of a rhetorical question for the professors who are listening. More people need to go into quarantine if professors are not keeping their seating charts accurately, and everybody, students as well as faculty, need to use the QR codes and maintain those seating chart configurations, because it really reduces the number of people who are going into quarantine.
Right. And even keeping a calendar. I know my memory isn't that great anymore, but trying to think who you had those significant interactions with on various days, especially if it's somebody out of your routine, so that if it is warranted that we need to find out who you came in contact with, you have a better idea.
Yeah.
And Nancy, could you just, on that front, one of the things that I was kind of mentioning is that it seems that, our cases at Lewis are relatively modest compared to some other things that we're reading in the newspapers and in the media. And I know media can have a tendency to try to find those places that have the greatest number of cases because they maybe, sell more news. But then as you say, the contact tracing and then the quarantining, for just the general audience, is there a number that we're seeing connected to each case? So if we have a case, is it 5 people that are quarantined on average, or 7 or 10, or does it just matter who the person is? And to your point, how many people they would put in their little log of people that they're close to? They're social butterflies, or they tend to be more, reserved or shy. So I guess that's one set of questions, but I'd really love to hear you, as somebody who really studies epidemiology and obviously has helped us, you and Lori and a whole host of other people that have helped us to design this system, to just talk a little bit about your sense of how well we're doing as a community of 7,000 people in terms of the number of cases. Because I think the university community is really interested in the relative nature of our number of cases and how well we're doing compared to other schools. Because if you just get a raw number, you may not have a sense of what that means.
Right. And well, let's see, for the first question, I'd say, some of our case contacts are really limited. So if it's students in a major class, sometimes they always sit next to the same people, whatever class they're in. So that does kind of limit if there's an exposure. It's the same exposure in each class. You have people that are in more socially interactive activities like sports. And even though they're not competing, they are, practicing and intermingling together. So that might increase their number of contacts. Same with our students that might be in suites. Even though they're not living together, that sharing of a bathroom and that nature may have them be considered a household contact. And that warrants quarantine also. Yeah. Going from our planning stage and how we're doing right now, I think we should be really proud to be Lewis community. We're really, all the aspects of our mission are coming together. From our knowledge, people know we're educating, we're using the best evidence that we have, and being willing to change course when more information comes about. So that really ties into our wisdom. Of course, the association is, we couldn't have done any of this without the communication and collaboration across disciplines, scope of work. Everybody on the university is all in on this. And then, keeping our justice in mind that sometimes we have to give up some of our freedom, our pleasures, our conveniences, so that we can protect others, especially those that are most vulnerable.
Yeah.
And then fidelity. That's how we keep our hope that we're doing the right thing and this is going to be okay.
Yeah.
So I think that
Great.
putting all that together has really helped us to be on the ball, respond to things, change our actions, and be really student-centered and employee and community-centered.
Yeah, it's really well put, Nancy. Thank you so much for that. It's great to hear it articulated that way, and I do feel that, we as a community should be really proud. I'm very proud of all the, colleagues I work with, and very proud of the students for the way that they've been responding to the request, as you say, to kind of limit the way that they would like to live in order to benefit the rest of the community. And I think it's showing in our numbers that that the students are willing to do that, and because they want to be on campus and they want to be able to have some, I think on average a student might have 2 classes online and 3 classes in a hybrid mode, or 3 classes online and 2 classes in a hybrid mode, or an in-person mode. And that's not, for many of those students, that's not what they want, but they are willing, in order to maintain that. It really seems that the numbers are showing us that they are willing to, not do all the things that they'd like to do together, and limit, create the physical distance that keeps them safe, and wash their hands more often, all those things that are basic to preventing the spread of this virus.
Right. And I think that it has shown our students are really good at reporting any symptoms. It's tricky now with allergy season. There's other viruses, strep going around. Students may have had a flu shot and may have had some feelings, the day afterwards. So, but it's a big part of adulting, of growing in that self-awareness of what's regular, what's usual for you. And then, getting guidance of, this is something that I should be more concerned about in this time of COVID.
Yeah, this might be a good time to make a couple of announcements, and then I have several more questions for Nancy. But we had a question come in around planning for the spring, so I just want to say that there's a lot of conversation going on around the plan for the spring. Our promise is that we will have registration in the regular format, which is, would be in the middle of next month. Registration would happen, and we'll have very clear description of the spring schedule and modalities, and how we're going to how it's going to be an online or hybrid or in person, so students can know exactly what the classes that they're signing up for in registration. And so we're having the conversations that will allow us to build that schedule this week and next week and so on. And so that's progressing, and I was reminded of that listening to Nancy talk about what we've learned, and you talk about what we've learned about how people are responding so far in these first 3 weeks. But it's only been 3 weeks, so every day that goes by we learn more, and that goes into our care for planning the spring semester. The second thing I want to say is that we are provisionally planning next week's show to focus more in depth around the isolation and quarantine experience and support for students that are on campus especially, but all students who are, and employees too, who are going through that isolation and or quarantine experience on campus. And we have a very thoughtful and detailed approach to it, and I know Nancy knows a lot about it, but I think we'll go into, and I want to ask you about it now, but we'll go into even more detail, and maybe even talk next week more about holistic health of of students in terms of even a broader look than only focusing on quarantine and isolation. But so this is a question I'll ask you, but no, I just want everyone to know that we're really thinking about this and working hard on providing a very supportive quarantine and isolation experience in the LaSallian spirit. And it's one of my things I'm most proud about working on right now is making sure that our students are cared for. So with all of that preamble, Nancy, what can you tell us about that, how that's going with people going into quarantine, and how are they doing? And I know everyone is an individual and they have different needs and different ways of living through it.
Right, and that really is the key of talking to the person that needs to either quarantine or isolate. Their comfort level of staying in the situation that they're in. Maybe if they're quarantining, and even if they're in a room by themselves, the comfort level of their suite mates in another room. And we found that students are really great communicators with each other, and they understand what anxiety they might be causing. And so some have chosen to move to a different room for quarantine. We ask about, their home situation, if they would want to return home, and we want to make sure it would be a safe environment for themselves and their family. We wouldn't want them to expose, even if they're quarantining, they're potentially able to expose somebody, and we want to make sure that it's a safe if they choose to go home.
Right.
That's great. So Nancy, I guess I am interested in, we just want to acknowledge, I guess, how grateful we are for the work that you're doing in this. And maybe, you were supposed to be on sabbatical this year, and that may not mean as much to some of the students watching, but it certainly means a lot to the faculty that are watching, and that you are coordinating this response in terms of the contact tracing is a significant issue for us, and we're just really grateful. But maybe you could talk a little bit about your own research, and maybe, I don't know if there are overlaps in terms of what you're doing now and how that might leverage into some of the research you've either done in the past or we're planning on doing this semester. So maybe you could talk a little bit about that?
Sure. I guess the opportunity, I'm hoping it's a once in a lifetime opportunity. We're not going to have a pandemic real soon, but I've always prepared in public health. I teach public and community health, and a big part of that is epidemiology. So this was my wheelhouse. And if there's anything positive in that pandemic, was that I was able to, step forward and work with some really wonderful people that had been planning, this all summer or since spring. So it's just a blessing to be able to do that. And so that enhances the idea of your sabbatical should be rejuvenating yourself. I wouldn't say this is rejuvenating, but it is kind of cementing the purpose that I have in doing public health.
Yeah.
My other work that I was planning on doing, and I'm still doing, is looking at our nurse preparation programs, especially our undergraduate nurses. We often hear employers or others in the community say, oh, it's because they're a Lewis nurse. And it's generally in a positive framing. And we've never looked at what does that mean when they say a Lewis nurse. So I'll be doing some interviewing and trying to qualify that into different virtues or characteristics. So that will be rejuvenating.
So many of our faculty are just so engaged in our community and their communities. doing research and other contributions. Our nursing faculty are profoundly impactful, across the region. And I've never known anyone more connected to the community than Nancy. Right. She is so in touch with what's going on out there. And so I just want to ask, this is a really general question, so it may be hard to answer, but I'm just kind of curious, from your network, what you're hearing about how things are evolving in, the region, in Will County and Illinois, or even nationally. What are you hearing about what people are seeing in the next 2 months around COVID-19 especially?
Well, I think a lot of the talk now at the local Board of Health meetings and that is just continuing our resilience, not letting our guard down, continually looking at the data, responding as needed, and responding quickly. And maybe that's not a popular notion, but we're seeing the cause and effect. Maybe we can't do research to show the direct correlation, but there is a causative factor there. And right now we have to go with that. A lot of the discussion in the local counties and state and federal is preparing for vaccine distribution. And that will likely, we already have emergency plans for like bioterrorism and pharmaceutical distribution. So that same plan likely would be put into effect to be able to mass distribute the vaccine when it is available.
That's great.
That's great. Yeah, I know. I mean, I know it's just impossible to tell when that would be, or, I know it's a fraught subject, but it's nice to know that there's not going to be a lot of waiting once it is available, or once, it's comforting to know that the public health agencies are preparing for it, even if they don't know when it's going to happen.
Right.
I think I'm asked out.
That's great. Well, Nancy, we just want to say again how grateful we are for you joining us and all the work you're doing to keep especially our students, but our entire community healthy and safe. And I really love what you and Chris said in terms of, when people are in isolation or quarantine, it can be a really challenging thing. And where our values really come into play is being with people when they're in that, difficult time. They're feeling sick, and they're also isolated from their friends and those people that they really care about. So our ability as a community to reach out to them and be present to them in a variety of ways, and this is really a teaser for next week as well. We'll talk about this in more detail, but I think our values are really playing into that, really wanting to give those students and those employees the sense that we are in association with them, we care about them, and we're going to be there for them for those 10 or 14 days that they have to be in quarantine or isolation. So thank you for all the work you're doing. Really, really grateful for that. And thank you to everybody for joining us today. We're grateful for your watching and staying in tune with what's going on campus. And we will see you next week with a deeper dive into the way that we really use our values to respond to those people that are in quarantine and isolation. So many blessings on all of you and your families, and have a wonderful week.